Great question. So breast reduction patients unfortunately have a decently high rate of wound healing problems. So up to 20% of patients will have openings in their incisions, and they always happen in the same places. And there's a reason why. So the places you typically see them is right under the areola where that vertical incision starts, and also right at the bottom of that vertical incision. And that's true whether or not you have a lollipop incision or a wise pattern anchor incision. So these are the areas that are issues with healing because of blood supply, just how we do the surgery. Now, there are some things that you can do to minimize the chance that you have wound healing issues. So just basic general stuff, be healthy going into surgery and take good care of your body. And you can also consider using a Prevena vac to help heal the area better. And there's decent evidence that this actually minimizes problems with healing in breast reduction patients. So the Prevena vac is not usually covered by insurance, but I think it's worth the investment to not have these problems, because wounds from breast reductions are not life-threatening issues. They're a nuisance complication, and they can torture you for weeks and weeks and sometimes months. So spending $1,000 on the Prevena vac to minimize your chance of having this, I think is a good buy. And then let's talk about spitting sutures, because you'll hear this all the time. Spitting sutures, or suture abscesses as they're sometimes known. So in general, with plastic surgery of the breast, we use dissolvable stitches. So we're putting stitches under the skin that dissolve with time. And depending on how large the suture is, how big the diameter of the suture, and what type of material it is, they can last from a couple days to many months. And so when you have something under your skin that your body's dissolving, there's really two competing forces. There is the body's desire to shove foreign things to the surface, to the skin layer, and then there's also the body dissolving whatever that substance is. So in most patients, the dissolving is what wins. And so your body will dissolve that stitch, it goes away, and you never know better. But sometimes the shoving things to the surface wins, and your body will shove that stitch up to the skin, and you'll see it pop through the incision. And often when it pops through the incision, it's a little wad of goo. It's like an inflammatory mass, because your body, in addition to shoving it to the surface, it was also trying to dissolve it. So it actually looks like pus when it comes out. So that's where it gets the name suture abscess, but it's not really a true abscess, and it's not an infection. Now, some patients, this just happens to them. So every time they have dissolvable stitches, for whatever reason, their body aggressively shoves them to the surface. But in general, it just happens here or there, and we don't see it a lot of different places. You'll see it most commonly at the end of a running suture where there's a knot, especially at that top layer that's right at the surface of the skin, because it doesn't have as far to be pushed out. So it's more likely to make an appearance, so to speak. So we don't see a lot of suture abscesses, luckily, but they can be really annoying for patients, especially if you're someone who gets lots of them. Now, the best way to treat a suture abscess is typically to remove the material. If there's any suture material still there, clean it with soap and water. And I like to spray the area with hypochlorous acid spray, because it helps keep the chance of infection down, and it helps bring oxygen to the area and reduce inflammation. So that's usually how I treat these things. But both of these problems, like I said, can be relatively common in breast reductions, and it's important to talk it out with your surgeon so you have a plan going forward if you suffer these complications. But hopefully you won't.